We had hands-on with cadaver body, and we also had hands-on with the mannequins at every age, every different size.
This simulation was hands-on. You had responses. You could hear breath sounds. You had mothers talking to you. It was more of a real situation.
You really felt like, in a way, your mind got into it, that you were really in a situation where that was an actual real patient there. They had IV fluids actually attached to the body, and we were actually running real fluids in. We were actually running real oxygen into the masks. We were actually using hands-on the same exact equipment that we would use in our hospital on our patients. The mannequins also interacted with you. They whatever you did to them, they would react like a real human being would.
I think this is an experience that they are going to take back to their hospitals that is unique to anything I've ever seen. I actually was in the observer role today, so I got to see how each one of the teams progressed in their maturity, and then I got to see each one of the different scenarios and go through the gross anatomy lab. And I've been a nurse a very long time, and as a nurse educator, this has been a unique and valuable experience, something I've never had in all the years I've been nursing.
We learned new ways of thinking, and I'm hoping to take those new ways of thinking and the other suggestions that other people had and go back to my facility and share that, and maybe change some minds, and maybe we can make a difference in the way we treat peds and adolescents at our hospital.
To think of what you learned in a classroom setting and then see that on an actual real body, and then go into the simulation area and think about how that would interplay into all that you're doing for the patient.
This is incorporating some elements that we just don't have access to. And I think that really helps the nurses to put the pieces of the puzzle together.
It's very realistic for nurses when we're able to see and do hands-on, not just reading it in a book or seeing it in a magazine, where you could actually touch and feel and know and have someone explain it to you so in depth.
What I'm hoping will happen is that what I've seen of the enthusiasm that's been generated by the faculty here and the enthusiastic response from our staff is that they're going to take that enthusiasm and some of what they've learned here and help to grow some of our other staff members. We have an opportunity for some growth, and this has just been, if they keep this momentum up and they share their knowledge, which I truly believe this group will do, that's going to, I think, reflect the investment of time and money that's been put out for these couple of days.